all right, I feel like I'm getting better at this. I don't know, more comfortable, or I really don't care. But we are going on to the Reese. This is specifically looking towards the orbits. Clinical sites do these for MRI screening. Say somebody has metal in their eye. Before they have an MRI, they will order some x-rays, make sure the patient's nice and clear. So typically they will do a Waters and a Reese. So there is a Reese. We have two orbits. So sometimes you will do bilateral, sometimes you will only do one side. It depends on the clinical indications. So the Reese is just looking at the orbit, and in order to do that, it's very simple. You just want the cheek, nose, chin. Have them put those three tri-points on the IR and center that affected orbit over the crosshairs. And that is all you need to know. Now it's hard because Mr. Scully does not have a nose to rest on, but it's going to make the orbit parallel to the IR, because if you look into the orbits right now, you can see they're kind of at an angle. So in order to get a nice PA projection of the orbits, we have to use that cheek, nose, chin. Put those 3 points on there, put the crosshairs over the eye that is affected, and voila. But one thing though is to make sure collimate. This field size would be way too big. You're going to need to really bring it down small. And this is even kind of big for some clinical sites. All right, again, there's room in there for you to be able to put your marker. You want to put that nose, cheek, and chin and center over that eye. Thank you, Sarah. And as you can tell, there's no landmark, bony landmarks that we can center on, so we have to focus on the exit portion. Exit right over that eye. And how people are, if they're sitting, you should be able to look over, or as you can see from the view that Sarah has, you're able to see if you're positioned correctly or not. All right, and so this is going to be for a PA Reese method of the orbits.